I'm so sorry. These cookies from Publix, really good. All right. My bad, y'all. Publix sugar cookies with the sprinkles. Make you want to dance. All right, my bad. Y'all know what time it is. NCLEX Jeopardy. Bonnie said, I need a cookie. A Rustic said, yes. Right? And they gotta be the soft kind. Can't be hard. All right, gotta be the soft kind. All right. Let's go into our NCLEX Jeopardy for the day. All right. Okay, so hello guys, hello. First of all, happy Cinco de Mayo, okay? Which is also really funny because Cinco de Mayo is always a precursor / pre-game of Nurses Week. And I just feel like God did that on purpose. And I'm not mad. I'm not mad at you. I see what you're doing there. I am picking up what you are putting down, Lord. I see why you have Cinco de Mayo before Nurses Week. I see it. But, all right, so on this special Cinco de Mayo and the day before the start of Nurses Week, we also have, what did I say? Oh, no, NCLEX Jeopardy. Duh, that's what today is. So if you have never been to NCLEX Jeopardy and it's your first time, please let me know down here in the comments below. Let me know that it's your first time. For all my boos that have, been here before. All right, what's up? Just tell me hi. So I can say welcome back. Okay, so if you have not been here before, if it is your first time, welcome. This is NCLEX Jeopardy, which is basically our NCLEX style practice review. And we go through NCLEX style questions till about 8 o'clock tonight. And also, if you have the Nurse Sam app downloaded, then you get to play all of the questions, especially the ones that we didn't get to go over. So I love to do these like weekly free like group reviews. It's almost like group study group. All right. It's the closest you can get to me tutoring free on a weekly basis. Okay. We go over for NCLEX Jeopardy. It really is Jeopardy style. We have the blue screen. We have the categories, the 5 questions per category, ranging from 100 to 500. And of course, we're playing for points. That's why it ranges. Okay. My handy dandy pen. So let me go ahead and go into, all right, so our categories for today, we have 5 categories. We usually have 5 categories every week, except for Tease Tuesday, it's 4 categories because it's 4 sections. But True Jeopardy style is about like 5 categories. And our categories for this week are Pharmacology, Pediatrics, Mental Health, Fundamentals, and Adult Health / Med-Surg. That's what that is. So, like I said, we have questions ranging from 100 to 500 points, and we just go through them, and whoever answers correctly gets those points. In order for you to answer correctly, you have to actually answer it in Jeopardy style. All right, you actually have to say what is, and then whatever the answer is. You don't have to like write out the actual answer. You can just say 1, 2, 3, or 4 because it is multiple choice. 1, 2, 3, or 4. Okay. Let me see. If you have any more questions, if I missed anything, just go ahead and just put it down in the comments below, and I will answer it. Hold on, I think somebody else had a comment. Let me look. I'm an LPN. Ew. All right, so I see a bunch of you first timers. Hello, all my first timers. Hey, Naza. I think Naza won last week. What's up, girl? Was it 2 weeks ago? 1 week or 2 weeks ago? Naza won. So great job, girl. Frenchie Marie's your first time. Michaela, first time. Stronger Connection, Blueprint Lashes, Ermani. I'm not sure how to say that, but that's kind of cute. That's cute. Lola, what's up? What's up? All right, all my first timers. Hey, Nikki, baby. What's up? All right, so Frenchie said good prep. Yes, this is awesome prep. It's great practice. It's free. It's weekly. Okay, I can't tell you how many people I have come to me saying, hey, I passed insert test here, insert NCLEX here, whether it be for RN or PN. I passed it because I came to your weekly group reviews for NCLEX Jeopardy, and I had a question that was on there. I had a question that was similar to one of the ones that you went over, and that's exactly why we do this. All right, this is definitely open and welcome to PNs and RN students. Okay, this content is not going to change whether you're a registered nurse or registered nursing student or a practical nursing student. Hypertension is going to be hypertension no matter what your credentials are. You see what I'm saying? So that's basically what we're doing. Oh yes, Frenchie said, I haven't even started yet, but I'm manifesting and getting ahead. Listen, you living in the year 3000 because you are ahead of the game. Okay. All right. So I already told you guys our categories, and just in case I have some people that are coming in that did not hear the categories, I'm gonna tell them one more time. All right, NCLEX Jeopardy for today. Our categories are going to be pharmacology, pediatrics, mental health, fundamentals, and adult health / med surg. Okay. So how it plays. Rules, once again, I am going to say, I'm going to read the question. I'm going to read the answer choices. You guys are going to respond back Jeopardy style. So you have to say what is, and then whatever the answer is. So 1, 2, 3, or 4. Your full answer has to be what is 1, 2, 3, or 4. All right. The first person on my screen to get the answer correct is going to be the winner of those points. Okay. And I say that with the whole my screen thing because sometimes the IG live lags, sometimes it lags, depends on internet, all this stuff. So just in case you see a different person on yours, I can't see that person on yours. So I can only go by what's on my screen. So don't beat me up. You know, we're just playing for fun. Oh my God, my cookie. We're just playing for fun. But in addition to fun and just really wanting to like motivate you guys to prep and review and study more, this is definitely just a great all-around review. So obviously if you don't get the answer first, but you still get it correct, you're still winning because obviously on the NCLEX, it's not Jeopardy style. It's not who's first. You're still going to get those points. So as long as you are answering, even if you are playing for points or don't want to play for points, you just want to sit in for the review. As long as you are answering these questions and actually like trying and taking note when we go through the rationale, it's going to help your comprehension. And I promise you, like I said, people have seen these questions or have gone over these like same topics. And it's like, oh my gosh, but the way you explained it in NCLEX Jeopardy really helped. That's why we do this. Okay. All right. So once again, if y'all have any more questions about gameplay, how to play, drop them in the comments below. And either I'll answer them or somebody's going to answer for you. All right. So if you guys are ready to go ahead and get started with our first question of tonight, give me a thumbs up. Thumbs up in the comments. Thumbs up in the comments. And who has their like tequila or margaritas? This isn't tequila, I promise. This is ginger ale. Just ginger ale. It's not ginger ale and tequila, which is an amazing combination. But that's just ginger ale today. Okay. All right, so we have some thumbs up. So let's go ahead and get started. Let's get started with adult health for 400. All right, this is adult health for 400. Once again, I'm going to read the question and the answer choices, and then you're going to respond back what is, and then whatever the answer is in the comments. Okay? Good luck. All right, so the nurse is caring for a client with gastroesophageal reflux disease, or Gerd, okay, and provides client education on measures to decrease Gerd. Which statement made by the client indicates a need for further teaching? 1. I plan to eat 4 to 6 meals. I plan to eat 4 to 6 small meals a day. 2, I should sleep in the right side lying position. 3, I plan to have a snack 1 hour before going to bed. Or 4, I will stop having a glass of wine each evening with dinner. All right, so I'm gonna read that question once again. We have a nurse that's caring for a client with Gerd, or gastroesophageal reflux disease, and provides client education on measures to decrease the Gerd. Which statement made by the client indicates a need for further teaching? 1, I plan to eat 4 to 6 small meals a day. 2, I should sleep in the right side lying position. 3, I plan to have a snack 1 hour before going to bed. Or 4, I will stop having a glass of wine each evening with dinner. What is our answer? Remember, we are looking for the statement made by the client that indicates a need for further teaching. Okay. All right, so let me scroll up to see your answers, so the start of your answers, and then let's go ahead and see what the answer is. Drum roll, please. Silent drum roll. The answer is, what is 3? What is 3? I plan to have a snack 1 hour before going to bed. That is the correct answer in answering this question. Remember, the question is asking you, which statement made by the client indicates a need for further teaching? A need for further teaching. All right. So whenever you see that, whenever you're looking for a statement made by whomever, but especially the client, that indicates a need for further teaching, just kind of break that down. If somebody says something to you and they need further teaching, that means whatever they're saying to you don't make a lick of sense. It is incorrect. It's wrong. They need further teaching. Like, hold up. Whoa. I hear what you just told me, but I'm so sorry. I love you so much, but you're wrong. You're wrong, my love. Let me go ahead and further teach you a little bit more, okay? So the answer, once again, is 3. I plan to have a snack 1 hour before going to bed. If you're trying to provide client education that has GERD on ways to decrease their GERD, and they come and be like, oh, okay, so that means I'm gonna have a snack 1 hour before going to bed. Girl, were you paying attention during the client teaching? No, absolutely not. You must have been paying Candy Crush or something like that. But come on, pay attention. That is not correct. That's not what you want to do. All right, rationale right here says the control of GERD involves lifestyle changes to promote health and control the reflux. All right, these include eating 4 to 6 small meals a day. That was number 1. Number 1, if he or she would have said that, I'd be like, okay, you was paying attention. Snaps for you. So because 1 is correct and we're looking for the incorrect answer, that's why 1 was wrong. Okay, so we can cross 1 out. That's not the answer to our question. Next thing, avoid alcohol and smoking. Okay, that's going to, once again, control GERD. Sleeping in the right side lying position. What does that do? That promotes oxygenation and frequent swallowing to clear the esophagus, okay? So that is a way to decrease GERD. Lying on your right side and going to sleep that way. I had to make sure, put my L's up and make sure this is my right. So lying on the right-sided, right side lying position is a way to decrease GERD because A, it promotes oxygenation, and B, it promotes frequent swallowing so that you clear the esophagus. All right, so that's something that you would do to decrease GERD. So that's not the answer either. And then it says avoid eating at least 3 hours before going to bed because reflux episodes are most damaging at night. All right, so remember, back to the question. It said, I plan to have a snack 1 hour before going to bed. All right. And then right here in the rationale, it says it needs to be at least 3 hours, not no 1 hour, okay? At least 3 hours before going to bed. So that is why 3 was our answer, because that is the incorrect statement that would indicate a need for further teaching. The person that said, what is 3 first on my screen it's Gigi. Ah, my pen. Hey, Gigi. Okay, so X, G. G. Dun, dun. Great job, Gigi. Gigi, is that you from Tease Tuesday, boo? Look at you. Yes. I think you have your teas like later on this week, right? Like Sunday or something like that. I can't remember what day. But look at you answering these questions, these NCLEX questions right. Okay now. All right, so it's Gigi. You on the scoreboard with 400 points. Everybody else that got it correct, even though you weren't first, at least you got it correct. Because once again, if this was the NCLEX or a practice test or whatever, you would have got the answer correct. You didn't have to put what is, and it doesn't matter if you're first or not. As long as you get the correct answer, that's what we're going for. We're just playing for points because it's fun, and we like free things, okay? So great job, it's Gigi. Who else answered correctly? Lauren, hey boo hey. Jador, wait, go back. Yeah, Jador, great job. Naza Lifestyle, great job. Last week's winner. Easy Breezy, Brielle. I see you. Nika Boo, great job. Ermani? I'm not sure. But great job. Mush Tao, great job. Miss Nikki for you. Neither Goddess. Go back. Neither Goddess. NC Pink Rose. They shouldn't eat 3 hours before bed, not 2. I don't know what you said. I do not know what you said. Whoever wrote that in Spanish. Ooh. Yeah, I don't know what that says. I'm so sorry. Frenchie, it's okay. I'm the one who picked one. It is okay. That's why you do these questions, because then you know for next time. You got to pay a little bit more attention. But don't beat yourself up. Absolutely not. I'm great. Jador, you must have came in before I said it. So I can only go by what's first on my screen. Because on my screen, Miss Gigi was first. Yeah, I think you were like third on my screen, unfortunately. So sometimes there's a lag with your internet connection and Instagram Live. But I can only go by what's on my screen. So Miss Gigi gets the points. But everybody, you guys were still correct. So that is the ultimate gift, okay? Can you say why 2 was wrong again? I thought left lying was better for Gerd. It says right side lying is actually better because it promotes oxygenation and frequent swallowing to clear the esophagus. Left lying, isn't that like maternity? Hold on. Left side lying. Yeah, left side lying is like a pregnancy thing. Yeah. When you're pregnant, you have to lie on your left side because that improves circulation and gives blood an easier route from your heart to your placenta to nourish the baby. So pregnancy is you're supposed to be on your left side. But for GERD and oxygenation for yourself, you're supposed to be on the right side to help decrease the GERD. Nice to have a question. What's your question? Mocha, I just answered yours about left side. Lying. Now I'll answer your question after we go through our review. Right. Look at y'all knowing. Great job. Okay, so let's go ahead and get into our next question. Let's do... Wait for it. They don't know English, can somebody translate? Oh man. I actually don't know how to help with that one. Yeah, I don't know how to help with that one. I'm not sure, I'm so sorry. Frenchie said mental health, which is funny because I was just about to do mental health. All right, so this is mental health for 300. All right, mental health for 300. The home health nurse visits an agoraphobic client who experiences panic attacks. Which statement by the client would indicate a therapeutic response to behavioral and pharmacological treatment? Once again, the home health nurse visits an agoraphobic client who experiences panic attacks. which statement by the client would indicate a therapeutic response to behavioral and pharmacological treatment? Is it 1, I took an extra pill for anxiety and got through the funeral fairly well? 2, I worry that if I don't take my anxiety pill on time, I'll have one of those attacks. 3, taking my anxiety pills before I leave has helped me to cross the bridge and go to work every morning. And then 4, I went to the movies with my family and stayed through the whole film by sitting in a seat along the aisle. I'm going to read it one more time. The home health nurse visits an agoraphobic client who experiences panic attacks. Which statement made by the client would indicate a therapeutic response to both behavioral and pharmacological treatment? Is it 1, I took an extra pill for anxiety and got through the funeral fairly well? Is it 2, I worry that if I don't take my anxiety pills on time, I'll have one of those attacks? 3, taking my anxiety pills before I leave has helped me to cross the bridge and go to work every morning. And then 4, I went to the movies with my family and stayed through the whole film by sitting in a seat along the table. Along the aisle, my bad. What is our answer? Remember, we're looking for the statement that would indicate a therapeutic response to behavioral and pharmacological treatment. What is our answer? All right, let me see what y'all saying. I'm gonna repeat. Do y'all need me to repeat the choices once again? Are you good? No, I feel like everyone did it. All right, so the answer to that question is, what is 4? What is 4? That was a good one because a lot of people chose 3, but the answer is 4. All right. I went to the movies with my family and stayed through the whole film by sitting in a seat along the aisle. That is the answer, number 4. All right. So, wait. Let me see who got it first. Lauren. Hey, boo. Hey. All right. Lauren got that first. So you are on the scoreboard. I think I just spelled Lauren, my bad. But I know who you are. 300 points for you. All right, who else got what is 4? Heart like gold. I think like everybody else chose like what is 3? What is 3? Everyone's like, oh dang, I thought it was 3. But yeah, it's 3 would have been a good one, but the answer is 4. I'm about to read you why. Generalizing fears to a specific place or situation is the hallmark of agoraphobia. All right. Someone said I should have looked up agoraphobic. But that's why we do these questions, so that next time you'll know what agoraphobic is. That's why when we get these things, like, and y'all know, if y'all have been with NCLEX Jeopardy with me for a while, been doing it with me, then you know that I am no stranger to Google my love. I'll be like, wait, I don't know the answer to that. Actually, let me go ahead and Google this. I don't know what this medication is. Let me go ahead and Google it. I don't know what this disease or disorder is. Let me go ahead and Google it. Like, I am a big fan of Google, which is free, 24/7 and 365. Okay, I'm not going to be one of those that's pretending to know, everything from nursing school. Like I retained everything from nursing school, because I did not. All right. And someone else says that to you, they're lying, period. They're just lying. So agoraphobia, once again, is the generalizing of fears to a specific place or situation. All right. That's the hallmark sign of agoraphobia. For me personally, the only reason why I knew what agoraphobia was because there was a movie on Netflix the other day, like a couple months ago. What was it called? Like The Woman in the mirror? No, the man in the mirror. The woman in the attic. Shit. Ooh, hold on. Now it's gonna bother me. Hold on. The Netflix agoraphobic movie. 1 second. Phobic movie on Netflix. The Woman in the Window. That's what it was called. The Woman in the Window. The Woman in the Window. All right. That was a movie on Netflix. And there's a a funny like spoof to it as well. But yeah, they talked about her being literally agoraphobic. So y'all saying something else. Girl in the Basement. That's another movie. Girl in the Basement. What the hell? That's another one too. Yo. That's weird. But yeah, so the movie that I saw was The Woman in the Window, and that was about agoraphobia, and that's the only reason why it kind of clicked in my mind, which is another reason why I like to watch movies and TV shows and stuff like that, because they'll give real life, examples, even though it is fiction, of certain diseases. And sometimes when I'm studying certain chapters, I'll watch certain movies or I'll watch certain things. For example, cardiology. All I did was watch Dr. Yang episodes on Grey's Anatomy. That's all I did. All right, so let's go back. So once again, the answer is 4. So rationale says improvement is observed for an agoraphobic client when the client is able to demonstrate appropriate coping behaviors for anxiety reduction. All right. Taking extra anxiety medication would not indicate improvement, and you're not supposed to do that anyway. So you don't want to double up on your Xanax or whatever it is. That's definitely not what you want to do. Clock watching with regard to the medication schedule is also not a sign that the client is responding well to the treatment. Remember what the question is always asking you. Remember, this said, which statement by the client would indicate a therapeutic response to behavioral and pharmacological treatment? So, coping mechanisms and drugs. Which one would indicate a therapeutic response? The one that said clock. So about the clock watching, that one was number 2, where it says, if I don't take my anxiety pill on time, then I'm going to have a panic attack. That's clock watching regarding to the medication schedule. And that's not a sign that the client is responding well to the treatment. They're about to have a panic attack about not taking their meds to get a panic attack. So that's not the best response, letting us know, okay, this is working. So that's why 1 and 2 were out. It was between 3 and 4, and if you chose 3, don't beat yourself up about it, because that one was a good one. But remember, agoraphobia is the generalizing fear to a specific place or situation. All right. This one was, the correct answer said, I went to the movies with my family and actually stayed through the whole film by sitting in a seat along the aisle. That was a coping mechanism for them. So yes, they were able to watch the movie, but because of that behavioral coping mechanism, you knew that they were coping well, and actually staying through the entire, in this particular example, staying through the entire film because they went to the movies. If that makes sense. All right, so that's why it was 4. Let me see, grab it in the summer library. Thank you so much. There was an episode on Grey's too about agoraphobia. Absolutely. Great job. Okay, cool. All right, now let's go ahead and go to our next question. Let's do pharmacology. Let's do pharmacology since we was talking about it. All right, pharmacology for 200 points. Pharmacology for 200 points. It's agoraphobia. So add an A, take out the E, and take out that space. Agoraphobia. I think I spelled it wrong. Agoraphobia. Hey, future nurse. What's up? All right, so Pharmacology 4200. A thrombolytic is administered in the hospital emergency department to a client who has had a myocardial infarction, an MI. The client's spouse asks the nurse about the purpose of the medication. The nurse bases the response on which fact regarding this medication? 1. Thrombolytics suppress the production of fibrin. 2. Thrombolytics act to prevent thrombus formation. 3. Thrombolytics act to dissolve thrombi that have already formed. 4. Thrombolytics have been proved to reverse all detrimental effects of heart attacks. What is going to be the nurse's response based on which of those facts regarding this medication? What is our answer? All right, so the question, once again, a thrombolytic is administered in the hospital emergency department to a client who has suffered a myocardial infarction, or an MI. The client's spouse asked the nurse about the purpose of the medication. Once again, that medication was thrombolytics. Okay, the nurse bases the response on which fact regarding thrombolytics? 1. Thrombolytics suppress the production of fibrin. 2. Thrombolytics act to prevent thrombus formation. 3. Thrombolytics act to dissolve thrombi that have already formed. And then 4. Thrombolytics have been proved to reverse all detrimental effects of heart attacks. What is our answer? 1, 2, 3, or 4, and don't forget to say what is. What is our answer? Let me scroll all the way up. All right, so our correct answer is drum roll, please. Am I insane? Drum roll, please. The answer is, what is 3? What is 3? Thrombolytics act to dissolve thrombi that have already formed. Okay? The answer is, what is 3? Rationale says, thrombolytics are most effective when started within 4 to 6 hours after symptom onset and acts to dissolve or lyse is another word for dissolve, existing thrombi that are causing a blockage. Question. Hold on. Wait. Hold on. Okay, what is the difference? This is just a question really quick. Well, first, before I ask that question, let me go ahead and see who that first person is that said what is 3, and that was NC Pink Rose. Hey, boo, hey. So NC Pink Rose, you are on the scoreboard with 200 points. Congrats. Let me congratulate all my boos that got it correct. Mary, great job. Smiles, Miss Nikki for you. Nurse Tasha. Wait, you changed it to what? Wait, hold on, I didn't see you. I changed it to what? Immaculate Michelle, yeah, you. Toshiba, great job. Armani, Essence of Jewel. Lauren Sapp. It's Gigi the second time. Is that it? Yeah, great job. All right, so great job to everyone that said what is 3. Okay, so remember, it's rationale again said thrombolytics are most effective when started within 4 to 6 hours of symptom onset and to act to dissolve or lyse existing thrombi that are causing a blockage. This is a question that I want to ask y'all. Y'all don't have to say what it is. So just let me know if you know the answer. What is the difference between a thrombus or thrombi, singular, plural, and a blood clot? What is the difference between those two? What is the difference between a blood clot and a thrombus? Don't Google it. Wait, I think I asked it wrong. Hold on. I think I asked it wrong. 1 second. Okay, I asked it wrong. My bad. My bad. My bad. The actual question is, what's the difference between a thrombus and an embolism? Ooh, I feel stupid. What is the difference between an embolism and a thrombus? My bad. Thank you. Don't do me. Future ER nurse, you didn't have to do me like that. You didn't have to do me like that. You could let me have that one. You could have let me have it. But yes, my bad. What is the difference between a thrombus and an embolism? But the fact that y'all questioned it just meant y'all knew y'all stuff. And y'all was like, Nurse Sam, you're supposed to know your shit too, love. Don't do this. Okay. Basically. So yes, the difference between a thrombus and an embolism is that an embolism has broken off and is traveling. So an embolism is just a traveling thrombus. They both are blood clots, but one is stationary and just kind of stuck and piling up in like occluding whatever vessel. And then an embolism is a piece of that blood clot, or sometimes, like for example, it can also be a foreign object, like the catheter of a needle. The catheter of an IV needle. But that's when it breaks off and travels, pretty much. Yep. Yeah, so we got our days. Correct. All right, so let me live. Hey, Holistic J. Hey, boo. Natural by Nature Billionaire. Correct dislodgement. That's Mag 90. It won travels. Awesome job. First of all, I had to ask y'all that question because I specifically, to this day, mind you, I was in nursing school like 8 years ago. And I remember that question from my professor, and the whole class was stumped. We were like, bitch, we don't know. And I remember she said that, and I think something similar was like on my NCLEX, or it could have just been her exam, who knows. But I wanted to ask y'all that question as well, because I remember when I was asked, I was stumped. Clearly, because I couldn't even ask it again. All right, so great job, right? Great job. Let's go ahead and get into our next questiones. Let's go to pediatrics. Pediatrics. All right. This is pediatrics. This one's for 200 points. All right, pediatrics for 200 points. A pediatrician prescribes an intravenous solution or IV solution of 5% dextrose and half normal saline, or 0.45% normal saline, with 40 milliequivalents of potassium chloride for a child with hypotonic dehydration. I'm going to just say that one more time. A pediatrician prescribes an IV solution of 5% dextrose and half normal saline, or 0.45% normal saline, with a 40 milliequivalents of potassium chloride for a child with hypotonic dehydration. Please note that. All right, next part. The nurse performs which priority assessment before administering this IV prescription? The nurse performs which priority assessment before administering this IV prescription? Is it 1, obtains a weight, 2, takes the temperature, 3, takes the blood pressure, or 4, checks the amount of urine output? What is our answer? What is our answer? Y'all need me to repeat the specs again? Remember, we have a pediatrician that prescribed an IV solution of 5% dextrose and half normal saline with 40 milliequivalents of potassium chloride for a child that has a diagnosis of hypotonic dehydration. The nurse performs which priority assessment before administering this IV prescription? Is it 1, obtains a weight, 2, takes the temperature, 3, takes the blood pressure, or 4, checks the amount of urine output? What is our answer? Give y'all some time to answer that question. All right, let's look and see what that answer is. And the answer is, drum roll please. It's my drum roll, my bad. What is 4? What is 4? Checks the amount of urine output. What is 4? Check the amount of urine output. Who is the first person to say what is 4? It's my girl, Lauren. What's up, boo? All right, you are already on the scoreboard with 300 points, but now you have an added 200 points to make your total score 500, putting you in the lead, boo. Great job. It's Gigi. You're right behind her with 400 points, and NC Pink Rose right behind her with 200 points. Great job. Remember, if you're not on the scoreboard, but you're getting those answers correct, who's really winning? Everyone, obviously. But if you are not on the scoreboard and you aren't getting the questions correct, it is okay. Do not beat yourself up. That's why we do this weekly practice. Just like future ER nurse said, we all have our days, okay? I clearly had a moment. It's fine, okay? That's why we do this practice. Who else got it correct? Great for you. Future ER nurse, Smile 16, Toshiba, Nani Boo, Mary, Bensikip, I think I saw that you changed your answer to 4. Photos of Bree, Immaculate, Fat Red Bew, yeah, I got you. Bensikip, I saw that you changed your answer. Great job. Great. Awesome job. All right, so let's go ahead and get into the rationale of why it was 4, which was checks the amount of urine output. So, in hypotonic dehydration, electrolyte loss exceeds water loss. Does that make sense? So, the priority assessment before administering potassium chloride, an electrolyte, especially intravenously, would be to assess the status of the urine output. Why? Because potassium chloride should never, ever be administered in the presence of oliguria or anuria. All right? You guys know what that means? Oliguria and anuria. What does that mean? Use your medical terms. What does oliguria mean, and what does anuria mean in regards to urine output? What is oliguria? What is oliguria? Scant urine. And anuria is no urine. So it's basically in the presence of little to no urine output. So specifically, if the urine output is less, this is pediatrics, remember, if the urine output is less than 1 to 2 milliliters per kilogram per hour, potassium chloride should not be administered. All right, so the weight, temperature, and blood pressure, all those are appropriate assessments. But remember, the question said which priority assessments. Okay, make sure you guys are looking. Make sure you're looking out for those strategic words, for those priority words. Then you know, is it asking for the best response, the priority response? And in this case, it was asking for the priority assessment, not the correct assessment, because all of them are correct. But which one are you going to do first in regards to administering potassium chloride? Okay, so kind of remember the rules of potassium chloride. You don't give it in the presence of scant urine, little, which means little to little urine. So scant to no urine, oliguria, or anuria. All right. Does that make sense? That was beautiful. Y'all see what that's Mag said? No P, no K. No P, no K. That's cute. I'm gonna write that down. Sorry. No P, then no K. That's cute. That's really cute. I love that. I know you meant urine, not iron. I totally know what you meant. All right, so great job. Thank you for that. That's Mag 90. That was so cute. I love little reminders like that to help you, or memory reminders. I love those. So thanks so much. All right, so let's go ahead and get to our next question. I think we didn't do fundamentals. So let's do fundamentals. Ooh, let's do fundamentals for 500. Fundamentals for 500, okay? All right. The nurse is administering enteral feedings via a nasogastric tube or an NG tube. The nurse should take which action when caring for this client to maintain client safety? 1. Maintain the client in a supine position. 2. Change the NG tube with every other feeding. 3. Increase the rate of the feeding if the infusion falls behind schedule. Or 4. Check for tube placement and residual amount at least every 4 hours. I'll repeat that one more again. The nurse is administering enteral feedings via a nasogastric tube. The nurse should take which action when caring for this client to maintain client safety? Okay, so I had to say that loud. So, no, that's important. 1, maintain the client in a supine position. 2, change the NG tube with every other feeding. 3, increase the rate of the feeding if the infusion falls behind schedule. Or 4, check for tube placement and residual amounts at least every 4 hours. What is our answer? What is our answer? Okay. Wait, did everyone say the same thing? I'm like a proud mama. I'm just gonna cry in the corner real quick. 1 second. I'm so proud. All right, so the answer is what is 4. Y'all would have been mad if it was like what is 3 and all y'all was wrong, but I'm just kidding. But all y'all were right. If this was the NCLEX, that would have been a hair flip of a question because all y'all was like, you won't get us. Tube placement, sis. But great job. So the answer, once again, is what is 4. Great job to literally everybody. Check for tube placement and residual amount at least every 4 hours. All right. So I'm going to shout out everybody's names. Hold on 1 second. Great job. Boop, boop, boop. First person to get that, though, was I am Gigi Isaac. Hey, boo, hey. You on the scoreboard with 500 points and tied with my girl, Lauren. All right, so I'm Gigi was first. Then we have Toshiba, the next Gigi. Life with my Lauren, Mary. Oh, wait. Lauren, Mary, Talina, Kimmy K, Miss Nikki for you, Cammy, Essence. I think I got you already. Josh, is that Joshua? No, Jay Shu. Sure. Immaculate Michelle, Busty Dolls. That's funny. Fab Review. Great job. Awesome, awesome, awesome. Oh no, feature earnest. I did not see your answer. It didn't pop up for me. It did not pop up for me on my screen. What was your answer, future ER nurse? I wonder why they didn't. Naturally, by nature, I didn't see yours either. See, that's what I mean about this internet connection and Instagram Live. See, I didn't see y'all answers at all. Why does it do that? That's really weird. Yeah, I'm going back up through it. I'm just going, one by one, and I don't see it. That's so weird. What did you guys answer? Ben Sakib, I didn't see yours either. The internet is playing with us. The internet is playing with us. Internet, you better stop. NC Pink Rose. I feel like y'all all put 4, but it's making me mad that some of them not showing up. The internet is definitely playing with us. Try exiting and coming back. Just like future ER nurse said. I'm trying to get on that board, period, sis. All right, so exit and try to come back and see if that helps. All right, so I'm going to go into the rationale, even though all y'all got it. But I'm just going to go into the rationale just in case another part kind of comes up. NC Rose said, as long as NCLEX see our right answer. That was so poetic. I can't. I cannot. All right, so since we all know about 2 placements in NG feedings, all right, let's go ahead. So rationale says NG2 feedings are beneficial, but they present possible complications such as diarrhea, lactose intolerance, dumping syndrome, or excess fluid volume. Y'all know this, right? I know you do. If not, just write it down in the corner somewhere. All right. Quick question. What is the most common complication of tube feedings? What is the most common complication of tube feedings? Okay. Future ER nurse. Okie dokie. Aspiration. Absolutely. Aspiration pneumonia, specifically. Aspiration pneumonia. All right. Communicates nausea and vomiting. No, but I see why you said that, because that's nausea and vomiting is a thing on everything. Okay. But yes, the answer is aspiration pneumonia. That is the most common complication, which is caused by the regurgitation of formula, contents from the stomach into the respiratory tract. This risk can be minimized by checking the tube placement, making sure it's actually in the stomach and not in the stomach. Especially if it's, never mind. The risk can also be minimized by checking the pH and color of the aspirate. All right, there's a certain pH and color that will kind of confirm that it's in the stomach, as opposed to anywhere else that's not supposed to be. Okay, and then you're also supposed to check the residual amount. Okay, and also by keeping the head of the bed how many degrees elevated at all times? How many degrees elevated at all times should you keep the head of the bed, to decrease the risk of aspiration pneumonia? This is the bed. How many degrees? This is the head of the bed right here. How many degrees? This sucks. How many degrees should the should the head of the bed be? 30. It should be elevated to 30, at least 30, at all times. Okay? At least 30. So 30, 45, all great. But it has to be at least 30. At least nobody said 15. So 30, 45. Honestly, that as long as it's more than 30, it can really be the specifics can kind of like vary. But as long as it's above 30 or above, you're good. Okay. It says problems with diarrhea may be caused by infusing a formula that is cold, contaminated, or of the wrong consistency, or by infusing that formula too rapidly. That's also how you get dumping syndrome. You don't want that. You don't want that as a nurse. Absolutely. Nay said, I set them all the way up. Girl, your head of the bed gonna be like this. You gonna be like this getting the feedings. This the tube right here. This the tube right here, and this is you at 90 degrees. Absolutely. You are not gonna aspirate on my shift. No, ma'am. But yes, by infusing a formula too rapidly, you can cause diarrhea and most importantly, or most suckingly, dumping syndrome. All right. Then it says nasogastric tubes may be left in place from weeks to months, depending on the specific type of tube that's inserted. So changing it out every other feeding sucks for you. That would suck as the nurse. And then the feeding bag itself should be changed daily. All right. But once again, you need to check for that tube placement. Okay, by inserting the air and kind of having your, where's my stethoscope? Inputting, I think like 30 cc's of air. I can't remember. My nursing home days are like long behind me. But you you input 30 cc's of air, and then as you're doing that, you have your stethoscope like slightly to the side of the belly button, I believe. And X-ray. Okay, future ER nurse. But yeah, and then when you do that, you're supposed to hear, when you're putting the air in, and you're supposed to hear kind of like a small bubbling. All right, and that lets you know that confirms placement. And was I yelling? This was clogging my ears. My bad. So great job. Great job. Quick, a swoosh. Okay, swoosh. Okay, words. I said bubbling. But yeah, synonyms, semantics. Another question as far as tube placement and residual, because this came up so many times during like my nursing school career. I don't even know if it was on my NCLEX or not, because actually I think it was, because I clearly see this question multiple times. At what point, when you check residual amounts, but at what point should you not give the feeding? When you're checking residual amounts, when should you not, or at what amount should you not give or not proceed with the feeding, and then notify the physician, provider, whoever? When you check residual amount, and you check residual amount by, putting your, what's that thing called? I forgot what that thing's called, but putting that in there and then drawing back. At what milliliter and what amount should you not move forward with the feeding? Let me see what y'all saying. That means it's not being digested. You better go ahead, natural by nature billionaire. Absolutely, that's exactly what it means. So if you get a certain amount of that residual volume, you know not to go forward and continue on with feeding, because they're clearly not digesting whatever's in there already. The little scale that MD goes by. I'm seeing like 200 and 250. Hold on 1 second. Oh, let me look and see. It says more than 200. If it's more than 200, then you definitely should not proceed forward with the feedings. Syringe, that was the word I was looking for, sorry. Syringe was the word I was looking for. So yes, some people are saying 250. I'm saying 200, but just check with your book, check with your facility, and check with your school just to make sure. It also depends on the time the client was fed. Absolutely. Wait, go back. Hold on. Go back, Sam. Great job. But yes, perfect. Now let's go ahead. Let's do one more question. Hold on. I'm gonna get a good one. This is gonna be for 500 points. So hold on. I gotta make sure I get you guys a good one. Okay, 1 second. No, not that one. What about this one? Ooh, this one's good. This one's good. All right, we're going to do pharmacology for 500. Pharmacology for 500. All right, so here we go. A client diagnosed with depression is prescribed amitriptyline hydrochloride. During the initial phases of treatment, the client's care plan should include which nursing intervention? 1. Obtain daily drug blood levels. 2. Provide the client a tyramine-free diet. 3. Assess the client for anticholinergic effects. Or 4. Obtain postural blood pressure prior to each medication administration. I'm just going to run that all the way back. Okay, a client diagnosed with depression is prescribed amitriptyline hydrochloride. During the initial phases of treatment, the client's care plan should include which nursing intervention? 1. Obtain daily drug blood levels. 2. Provide the client a tyramine-free diet. 3. Assess the client for anticholinergic effects. And 4. Obtain postural blood pressures prior to each medication administration. All right, remember, going back to it, we have a client diagnosed with depression. They've been prescribed amitriptyline hydrochloride. During the initial phases of this treatment, what should be included as a nursing intervention in this client's care plan? Daily drug blood levels, providing the client with a tyramine-free diet, assess the client for anticholinergic effects, or 4, obtain postural blood pressure prior to each medication administration. What is our answer? Let me scroll up. Let me scroll all the way up. Let me get a drum roll, please. All right, the answer is, oh my gosh, if this would have closed, I would have been so pissed. What is 4? What is 4? Obtain postural blood pressures prior to each medication administration. All right, let's see what y'all saying. Wait, let me see. Who said 4? A lot of people said 3, which was assess the client for anticholinergic effects. Hold on 1 second. Hold on. Toshiba, I think is at least the first person, if not the only. Right, it's 4. It's 4. Obtain postural blood pressure. So Toshiba, you got that thing. Great job. Great job, Toshiba Hughes. All right, trust me, we're going to go into this rationale. Toshiba Hughes. Awesome job. Okay, so it says, I know y'all like, hold on. These questions really make you jump up and down. Like, I know you lying. Listen, NCLEX style questions will do that to you. All right, so let's go ahead. And yeah, she's the only person that got it. So great job, Toshiba. I don't know how you got that thing, because honestly, I probably would have said 3. I'm not even lying to you. I would have been 3 with the rest of y'all. But let's go ahead and get into it. So it says amitriptyline hydrochloride. First of all, that is a tricyclic antidepressant. All right, it's a tricyclic antidepressant. A common side effect or adverse effect is orthostatic blood pressure changes, which can produce hypotension and tachycardia. Hypotension is low blood pressure and tachycardia is high pulse. So the tachycardia can be frightening to the client, and the hypotension is dangerous because it may result in dizziness and falling, in which they can injure themselves. All right, so they must be instructed to move slowly from a lying to a sitting position to a standing position to avoid injury if these changes are experienced. It says the client may experience some side/adverse effects, such as sedation, dry mouth, constipation, and blurred vision, which is all anticholinergic effects, but these effects are transient and will diminish with time. All right. Also, those effects aren't as, I guess, I don't want to say dangerous, but their safety isn't in jeopardy more than the orthostatic hypertension. That they can directly hurt themselves and be injured with that low blood pressure and tachycardia. But with sedation, dry mouth, constipation, blurred vision, yes, it's annoying, but once again, that will actually diminish with time. And then it says a tyramine-free diet is initiated for a client on MOAIs, not tricyclic antidepressants. All right, so a tyramine-free diet is initiated for clients on monoamine oxidase inhibitors. So MAOIs. That's what that is. That tyramine-free diet is for those type of meds. But this is a tricyclic antidepressant. And then as far as obtaining daily blood levels, it says blood levels are required for a client taking something like lithium, as far as like an antidepressant that needs to be monitored blood level wise. That's more so lithium, not amitriptyline. Okay. Thank you for writing it out, Mernice, the MAOI. That is for the tyramine-free diet. Yes, so this is definitely that was cute, Toshiba. Amy trips on things. Hold on, let me write that down, because that's cute. Hold on one second. Amy trips on things. Like amitriptyline. Amy trips on things. Girl, stop. Things. Girl. That was cute. And now I'm never going to forget that. I am never going to forget that. Every time I see amitriptyline, I'm like, look at Amy just tripping over things. Girl, please sit down. That's what I'm going to say, personally. That was so cute. Amitriptyline, Amy trips on things, so she will fall. That was really cute. Naturally nature, yes. 2 would be MOIs. 2 was tyramine-free diet. That's MOIs. The word initial. Absolutely. That's why I said it's very important to not only know your content, not only know, like, study the actual, like, diseases and side effects and everything like that. That's only half the battle. That is only half the battle. You also need to know how to answer these questions. You need to know how to spot certain words that will ultimately kind of shift the correct answer, or how you should look at the question to get the correct answer. So all the strategy words, whenever you see always, never, like all those absolute words, priority words, think about your ABCs, airway, breathing, circulation. There's certain strategies that you need to know and learn for the NCLEX, in addition to reading your chapters, because they're both going to work in your favor. You can't just know one. You have to know both. Okay, you have to at least be familiar with some strategies and stuff like that, because those priority words, that's really going to influence whatever the answer is. Like, how many times have you been like, okay, that answer is correct, but it's not the most correct? Like, what does that even mean, girl? What? But that is what the NCLEX is known for. So you see all these, memes and stuff like that about people saying, NCLEX is so hard and so tricky and blah, blah, blah. It wouldn't be so tricky if A, you practice, and B, you knew your content and your strategy. Once you start to practice enough, you get enough of the same questions, especially like if you practice early, eventually you'll start to see the same thing over and over again. I've been doing NCLEX Jeopardy for about like 2 years straight. I can't tell you how many questions and how many different resources I've used, and I've just come across the same question tons and tons and tons of times. But yeah, that's just my tip to you guys. Make sure you know your strategies as much as you know your content. Okay, I think we went over strategies in priority questions. Was it last week? I think it was last week. We had, during finals week, the final stretch campaign, we had a live every day. And during those lives, like, I taught you whatever you needed to know about both the T's and the NCLEX. So that was definitely one. If you missed out on those, especially that priority, knowing your strategy thing, if you missed out on that, definitely consider joining the Study Bar community. That's our monthly membership, and all the replays, especially all the replays of NCLEX Jeopardy, Teach Tuesday, all that stuff is on there. Okay, that's also the only way for you to access NCLEX Arcade. And I know I have some people on here now that was with me when I did the live, it was like a 6-day NCLEX Arcade webinar / adventure. That was, like I said, it was 6 days, and those questions, like around 200 questions of the top missed and the most missed questions on previous NCLEXs. So it's not like it was just like easy questions. No, we're focusing on the questions that everyone for some reason happened to miss the most. So we had a whole 18 hours of learning the rationale behind those questions and you guys doing it as well. So if you're interested in that, make sure you join the Study Bar community, studybarcommunity.com. It's a monthly membership for either $29.99 a month, or you can pay for the entire year and just pay $300 so you can get 2 months for free. Also, again, let me see what y'all doing. Which orange is the most orange? That is so true, Kimmy K. Which orange is the most orange? Future ERNS, and I'm going to my 2nd semester. I'm taking med-surg and mental health. See, now with mental health specifically, make sure you are taking questions practice questions as much as possible, because that therapeutic response, eventually that will, like mental health for me, but at this point is when I did not major or, go into a specialty of mental health. I've just taken so many mental health practice questions that now I can just answer it in my sleep. I'm not going to go into that specialty. But you start to recognize a pattern, especially with mental health, because there's a specific way that you're supposed to answer or communicate therapeutically. And most of the questions are about you communicating therapeutically to a patient that's, schizo or bipolar or whatever, having an episode. But communicating therapeutically is one of the big things with mental health. And as long as you kind of know the ins and outs of how to answer something therapeutically, you'll be good on the questions. So that's another one of the strategies that I just want to let you guys know of. Let me scroll back. All right, so give them an ace, it will cough in your face. That's so cute. A snow cake. That's for ACE inhibitors. You get the annoying cough, and you also get really the cough is really what I remember. I forgot what else you get with the ACE inhibitors. No second guessing. Imipramine stops my peeing. Congratulations to those that are graduating. Yes, great job. All right, scroll down. Let me see what y'all saying. All right, so we're going to do, what time is it? 8:18. We're going to do one more question, and we're going to do mental health, okay? Especially because right now we have a three-way tie between Lauren, I am Gigi, and Toshiba. So let's see who's going to break this tie. So let's go ahead and do mental health now that I said that. Nope, not that one. That's a question that would definitely be on there, but download the NurseSam app so that you guys can play all these questions. All right, so let's do this one. This one's gonna probably be the best ones. No, that's an easy one. Hold on. No, easy one. Okay, let's do this one. This one is mental health for 300. All right, mental health for 300. This one's our last question. All right. The nurse is monitoring a hospitalized client who abuses alcohol. Which findings should alert the nurse to the potential for alcohol withdrawal delirium? Ranch. Oh, that's why you said ranch. Because I was like, why are you saying ranch? Now I want wings. Sorry. All right. The nurse is monitoring a hospitalized client who abuses alcohol. Y'all know I got ADHD. Don't do this to me. Which findings should alert the nurse to the potential for alcohol withdrawal delirium? 1. Hypotension, ataxia, hunger. 2. Stupor, lethargy, muscular rigidity. 3. Hypotension, coarse hand tremors, and lethargy. Or 4. Hypertension, changes in the level of consciousness and hallucinations. Which findings should alert the nurse to the potential for alcohol withdrawal delirium? That's another one in mental health that's frequently asked. That's another frequent flyer. Let's say that. All right, once again, we are monitoring you as the future nurses that you are. You're monitoring a hospitalized client who abuses alcohol. They abuse the sauce. Okay? This isn't tequila, it's ginger ale, just in case. Those looks make me look like I'm guilty, but I promise it's ginger ale. Which findings should alert the nurse, aka you, to the potential for alcohol withdrawal delirium? 1. Hypotension, ataxia, and hunger. 2. Stupor, lethargy, muscular rigidity. 3. Hypotension, coarse hand tremors. This is me saying coarse. And lethargy. And then 4, hypertension, changes in the level of consciousness and hallucinations. What's going to be our answer? Let me scroll up. Scroll up. All right. The answer. Okay, now I see y'all answers. Great job. All right, so the answer is what is 4. Hypertension, changes in the level of consciousness and hallucinations. That is the correct answer. All right, it says symptoms associated with alcohol withdrawal delirium typically include anxiety, insomnia, okay, they can't sleep, anorexia, lose weight, hypertension, high blood pressure, disorientation, hallucinations, changes in the level of consciousness. That would go from alert to confused. It changes. Agitation, fever, and delusions. Those are the typical symptoms of alcohol withdrawal delirium. Okay. First person to get that answer. Okay, and this is going to be like our tiebreaker. So trying to see who's the first person out of Lauren, I am Gigi Isaac, and Toshiba to get that one correct. And then I'm also, all right, so, and then obviously I'm calling out everyone that got the correct answer, period. So the answer once again is what is 4. Hold on one second. Okay, scrolled all the way up. What is 4? That's Mag 90s. First person to get it. Great job. Kimmy K also got it. Natural by Nature Billionaire. Awesome job. I know some of y'all needed this. Need these wins, obviously. Yari, Mama Bear. Great job. Toshiba is the first person out of the 3 to get this. So Toshiba, you get the points. Well, you break the tiebreaker. But the first person to answer was, wait for it. That's Mag 90. So that's Mag 90. You're going to get the 300 points. But Toshiba, you broke the tiebreaker of the 500 squad. So you are tonight's winner. Toshiba Hughes. Great job. All right, so let me finish going through everybody that got the correct answer. Bussy Dolls. Go back. Great job. Immaculate Michelle, Cammy Mums, NC Pink Rose. Great job. I am Gigi Isaac. You got it correct, but you answered after Toshiba. Mocha Alo. Great job. Individualist. It's a D. We know what you meant. Wait. Yay. No, yeah, you said it first. That's Mag. What is agitation? Agitation is very synonymous with like irritation. But when you're like agitated, you almost get like physically violent as well. But since you said that, asked that question, let me go ahead and actually get you the actual definition and not just me guessing. Agitated means feeling or appearing troubled or nervous. So it is synonymous with like irritated. Troubled in mind, disturbed, upset. So that's an example of agitation. Hand tremors got me. I wonder if was it the coarse hand tremors or just hand tremors? Because y'all know, for me, it would have been like, it said coarse hand tremors, so my mind would have been like, so is the real answer fine hand tremors? Like, which one is it? Every time I see like coarse or fine for hand tremors, and I don't see one of them, I'm like, okay, is it really coarse hand tremors, or are they tricking me with the coarse part and it's really supposed to be fine? But that's also an example of me overthinking. Hold on one second. Awesome. Wait, hold on. Let me go. That damn internet. See, I didn't see future ER nurse. I didn't see your answer again, but I saw that comment. It's so annoying. Okay. So once again, congratulations, Toshiba Hughes. You are the winner. I know you said you were taking your I think you're taking your NCLEX. I don't know if it was at the end of the week or the month. I'm not sure. But because you won NCLEX Jeopardy, you won a free Ultimate Nursing School bundle. So I'm not sure if you have the Ultimate Nursing School bundle already. If you do not, congratulations, you won. If you do have it, then we're just going to give you just another study kit that's not included in the Ultimate Nursing School bundle, like the critical care. But if you don't have it, then great. You won the Ultimate Nursing School bundle. It's regularly $97, but for everyone on here and pretty much the whole world, we are still we are in the middle of our Cinco de Mayo happy hour, which is our pre-game and our precursor to Nurses Week. So tonight's between the hours of 5 and 10 p.m. So this is over in about an hour and a half. You can get 50% off all digital study kits. So it doesn't matter if you need the ultimate, the first semester, the ATITs, whichever, or those are bundles, or you just want, one-off study kits like the pharmacology or dosage calculations or maternity. You can get 50% off if you use code HAPPY50. All right, this ends at 10 p.m. tonight Eastern Standard Time. So if you want to get your bundles in, if you want to purchase a bundle or a study kit or whatever to help supplement your studies, especially if you're a visual learner, use code HAPPY50 for 50% off all digital study kits, okay? And then if for some reason you miss the sale, tomorrow starts Nurses Week, and y'all know I have something special planned for every day of Nurses Week, all right? Not just for my nurses, but for my nursing students as well, okay? So once again, happy 50 for 50% off your next digital purchase. And then tomorrow starts the first day of Nurses Week, which is going to be the first day of a different deal every day. So make sure you take advantage of that if you need to. If you love this NCLEX Jeopardy, awesome. I'm so glad. That's why we do it. We do these every Thursday, unless I'm sick. But we do these every Thursday. Even when I'm on vacation, we do these. Literally, the only time I don't do these is when I'm sick. And like my girl Lauren knows. She was like, oh, you canceled it. That means you're sick. Are you good? No, I'm sick. But we do these every Thursday at 7 p.m. Eastern Standard Time. So make sure, and they're free, 100% free. Where else are you going to get this free, awesome, and fun practice where you can win games? I don't know where else, but here is one of the main places. So make sure you join in on the game next week as well. Once again, it's every Thursday at 7 p.m. I'll also let you guys know, like in my stories or on my page, letting you know that we are definitely having a session. Now, we only went through about like 5 or 6 questions, but every week I give you guys 25 that are free. So if you download the NurseSam app, you can go to the link in my bio, or go to my stories. I'm talking about downloading the app as well. It's a free download. You can play the mobile version of this game that we just played. I mean, y'all couldn't see it because I'm reading off of it, but you can actually play the mobile version where you'll be able to see the questions, see the answer choices, really test yourself in Jeopardy style, and then you'll be able to see the rationale, the answer and the rationale as well. Once again, 100% free. These questions, you get 25 free questions every week. We just go over like 5, 6, or however many of them during live to give you guys kind of like a taste of the new questions. But after we get off of live, I update the questions Do you have this in a section to review the questions? Yep, I do. Inside the NCLEX Prep of the Nurse Sam app. You can actually go and play the same questions that it's all in one game. But you can revisit the questions that we went over and play the other questions. Remember, there's 25 total, 25 new NCLEX style questions for you guys to study with every week in these categories. So, hold on, let me see what y'all saying. Absolutely. Okay, so you're Toshiba, awesome job. You have an NCLEX coming in a month or so, and you're doing great. So just make sure that you're just practicing as much as you can. And then same thing with Gigi. She said, know what you have to know, because it is more critical thinking. They're really cracking down on the whole critical thinking thing. All right. So make sure, once again, if you want to practice with these same questions, plus get access to the other like 18 that we didn't get a chance to go over, download the Nurse Sam app. It is 100% free. And when you open that app, go to NCLEX Prep. You'll see NCLEX Jeopardy Mobile. Click that, and you'll be able to see the 25 questions in Jeopardy style format on the Jeopardy board. Click a category, click a question, and you'll be able to get the question and the answer choices. And then as you're asking yourself that and kind of practicing, once you're finished answering the question, you press space bar or whatever the thing is. I think it's space bar for me. But you press space bar and it'll give you the answer and rationale. So 25 free practice questions every week, every Thursday. So I'm going to actually update the questions right now as we get off of live. I'm going to update the questions of the NCLEX Jeopardy, which is in the Nurse Sam app. I'll post about it again in my stories. And then obviously, once again, 50% off all digital study kits, all digital study bundles, 50% off until 10 p.m. Eastern Standard Time. So you have about an hour and a half to get 50% off whatever you need to get with code HAPPY50. Okay? If y'all have any other questions, please let me know. Best way to get in contact with me, and the fastest, honestly, is either send me a message on the Study Bar community, which is our membership, or send me an email to support@thenursesam.com. Okay? Remember, Toshiba, congratulations again, but remember to DM me your full name and email so I can go ahead and get that Ultimate Nursing School bundle to you. So don't forget to send me a DM with your email and your full name. Let me make sure I have your actual thing. Toshiba Hughes. Okay. All right. So thank you guys again. I will see y'all next week. Bye.